National Nursing Week is celebrated every year in the weeks surrounding Florence Nightingale's birthday, May 12th. To honor Halton's nurses this week, we'll highlight the selfless work they do every day. To kick it off, I spoke with a registered nurse from Burlington who works in pediatric mental health units at both McMaster Children's Hospital and Joseph Brant Hospital.
There's something about kids that makes you in the moment feel like we can do more for this person, and they're young and there's still quite a bit of hope there, right? So with kids, there's a feeling if they don't have hope, like we can have it for them. They have all the opportunities in the world available to them if they can just get the help they need.
For the last 14 years, Lauren Alexander has found joy nurturing patients, working as a registered nurse in mental health.
It's a great feeling when you can connect and they start opening up to you. It just feels amazing. It feels like you are making a difference, you know? And I think that's all anybody wants kind of with their job. I think it's really interesting with nursing because we all kind of find our niche and different things we're interested in that other people are like, ew, I would never do that. Like, how do you do that? And I mean, medical nurses will always be like, ugh, I don't know how you do mental health. And I'm always like, ugh, I don't know how you do medicine or surgery or whatever. And I think that's what's so cool about nursing, right? There's so many different pathways.
She genuinely cares about her patients. And in the past, some of the more difficult times were when her patients turned 18 and left the pediatric program.
Oh, you always kind of want to know how they're doing, but you don't really know, but you hope they're doing well, you know? So.
With the pandemic, her unit has been incredibly busy, with patients presenting anxiety and depression, and an increased number of suicide attempts and eating disorders.
When you go in, you're never sure what you're going into, and I think that's part of it, right? So it's just this feeling of anxiety, and coming home, yeah, like my routine has changed, right? Like I come home, and we have a little joke where it's like, mommy's COVID, don't touch mommy, right? So until I have my shower and my clothes get put right in the washing machine, my shoes often will stay outside and get Lysoled on the front porch. It's unfortunate for everyone, the kids and myself. And then there's this feeling of guilt I have about like, what if I pass it on to somebody else, which I think all of healthcare workers are kind of carrying in the back of their head right now. And then I think the second piece would be the emotional piece of just feeling overwhelmed and like often a little bit helpless in terms of like being able to help some of the kids. It feels a little bit hopeless right now. It's hard not to bring that home. You feel like, what could we have done differently? What could we have done that would have been more helpful in the moment? You know, we're all kind of just doing the best we can right now with the skills we have, as we like to say, on our unit.
Infection control in the unit is complicated by necessary environmental restrictions.
You can't just leave out like a PPE set like you would on a medical unit in front of a patient's room. It all has to be locked up, which means you have to like access cupboards with keys. We don't have, like kids can't have anything glass, anything metal, like everything is locked away, which is fine. But when it comes to PPE, we've had a real struggle. A lot of our patients, I mean, they're unwell, and for whatever reason, they're unable, they don't wear their mask. They do, I mean, come in close contact with us, even though we try not to do that. Sometimes it's because they're aggressive. Sometimes it's because they're psychotic, that they can't follow instructions. Sometimes it's just people being somewhat defiant in terms of like, that's just part of their illness. It happens. Sometimes they just, in the moment, they're having a panic attack, and we also have to support them, and they're not wearing their masks, and I don't think, I mean, I think that's a different challenge on a mental health unit, that adult or child, right? I think you would see that people don't really think about a lot, is that piece of like that risk that we're put at because our patients can't follow the rules or can't necessarily follow the instructions in terms of like what they need to do. So that piece has been difficult too. Like we've really struggled with that. I would say all of the people on our unit. I mean, just when you think things are improving, there's like more and more things that start happening. A big part of our clients or patients' care plans often involve having them go on leaves of absence overnight to practice their skills with their families, and then they come back in the morning. Those for a long time were taken away because we didn't want patients going back and forth, which meant the staffing stayed the same as when we had less patients, but all of a sudden we had a bunch of patients again because they weren't going anywhere. that's nobody's fault. It's just, it is what it is, but it's stressful, right? So it increases stress, it increases people feeling tired and burnt out. They need a break, like everyone, right? But I think, I mean, you don't really have that option, right? Because it's probably one of the busier areas right now. So it is what it is, but yeah.
Without the support of her fellow staff and management, it would be much worse.
When things have happened because of sort of some issues with COVID positive patients and people feeling overwhelmed, we've all been there to support each other. It really is a feeling of a family and support. And I don't think if we didn't have that, I think it would be a lot more difficult to deal with. I think that support is always there.
Happy National Nurses Week, Lauren. Thanks for all you do.